I'm talking today to Dr. Allon Barsam. Dr. Barsam is an ophthalmic surgeon in the UK. Hi, Dr. Barsam. Thank you so much for allowing me to interview you today for Askimo's International Library of Interviews with Experts.
Thank you, Joanne. It's a pleasure to be here with you today.
Great. Dr. Barsam, today we're talking about glaucoma surgery. So let's begin with what is glaucoma and who is at risk?
Glaucoma basically describes damage to the optic nerve, which is a cable at the back of the eye, which basically connects the eye to the brain. Now, in glaucoma, that damage occurs due to pressure inside the eye. Everyone has a what we consider to be a normal pressure inside the eye, and for different people, that pressure will be different. In some people, when they go above what is normal for them, it will result in damage to the optic nerve, and when that happens, it is said to be glaucoma. In terms of what kind of people are at risk?
Sorry. What are some of the symptoms that I may be suffering from glaucoma?
Well, most forms of glaucoma are completely free of symptoms. So that's one of the main things that defines the condition, is that there are no symptoms. So people do not know that they have glaucoma, certainly in the early stages. In the late stages of optic nerve damage, there will be parts of the edge of the vision missing, and eventually the vision can go completely. But at that point, the damage is irreversible. So really the whole focus of glaucoma diagnosis and treatment is to diagnose it and treat it early, before there are any symptoms. So everyone should have a screening check for glaucoma every year from the age of 50. And anyone with a family history of glaucoma, so anyone with a first-degree relative who has glaucoma, should have a yearly glaucoma screening check from the age of 40.
What are the various types of glaucoma, and which of these would require surgery?
There are lots and lots of different types of glaucoma. By far the most common form of glaucoma is something called primary open-angle glaucoma. It's called primary because it just occurs, and the cause is still unknown, despite the fact that it's very, very common, and it's still unknown. And it's called open-angle glaucoma because the part of the eye that drains fluid, which is the angle of the eye in between the cornea, the clear natural contact lens of the eye, and the iris, which is the coloured part of the eye, that's the drainage angle, that is open in primary open-angle glaucoma. There is a less common form of glaucoma called narrow-angle glaucoma, where the problem is with that drainage channel, and the treatment does vary between those two forms of glaucoma. However, under certain circumstances, surgery may be indicated in either of those conditions. But by far the most common way of treating glaucoma is with drops. It's very rare indeed nowadays, so effective are the drops that we have, to require surgery for glaucoma.
If it did require you to do surgery, what would that procedure involve?
Well, the traditional form of surgery in primary open-angle glaucoma is something called a trabeculectomy, which is basically a drainage procedure, which involves creating a little trapdoor on the sclera, which is the white, tough lining of the eye, a small incision into the eye and into the drainage angle of the eye, and then sealing it with conjunctiva, which is basically the lining of the white part of the eye, and it forms a little bleb, which is where fluid can accumulate and drain off, and it basically increases the drainage of fluid in the eye and thus reduces pressure. That's relatively big surgery as far as eye surgery goes, and now there's really a move to something called minimally invasive glaucoma surgery, which is becoming a lot more popular because it's, as its name suggests, it's less invasive. The risks are thought to be less, and it could be combined with cataract surgery. So it's becoming much more common to have this kind of minimally invasive glaucoma surgery combined with cataract surgery in someone who has glaucoma.
Is there any way that a person can reduce their risks of getting glaucoma?
Not really. In the narrow angle form, which is the less common form, you can have a laser procedure, something called a peripheral iridotomy, where a very accurate laser will make a little hole in the iris, the coloured part of the eye, and that allows a different access for fluid to drain off. Also, if patients with narrow angle glaucoma have a large lens or an early cataract, then cataract surgery is indicated earlier in these people to prevent glaucoma. But in terms of primary open angle glaucoma, which is by far the most common cause, there is nothing that any individual can do to prevent it. Having said that, if a patient has a high pressure in the eye diagnosed on a routine screening check, even if they don't have glaucoma, then treating that high pressure with glaucoma drops will prevent the onset of glaucoma. So really it all comes down to regular screening checks with local optometrist, optician or ophthalmologist for everyone. And if there is any high pressure or any other risk for the development of glaucoma identified, to treat the high pressure before glaucoma develops. So if someone has a high pressure and you treat the high pressure and make the pressure lower, then you can prevent that pressure resulting in damage, and that's really the key.
Thank you, Dr. Barsam. Thank you so much for talking to me today.
Thank you.